Hi, this is Challen Yi with bringing acupuncture mainstream, one talk at a time. And let's talk about one of my favorite subjects. It's called back pain. Back pain is probably the most common reason why people come to see me, and probably a lot of acupuncturists around the country, not just me. So if you're not anywhere near where I live, you're in luck because acupuncturists and acupuncture are really well tailored to address lower back pain. Now, having said that, lower back pain can manifest itself in many ways, some of which you are probably not aware of. The simplest form is just some tight muscles. Someone will come in and ask, "Hey, man, I got this tight muscle in my back. I just doesn't matter. I massage it, I stretch it. I just cannot get, I just cannot get rid of it." Now, acupuncture can work very well in that situation. One treatment can bring immediate relief and a significant decrease in muscle tightness. Other, the lower back is just an amazing suspension component. It's a support and suspension component. It's designed with this curve in the lumbar, and it's designed to carry load. It's designed to support our structure. It's there to protect the nerves, the nerve roots that are running through that area. It's like Grand Central Station, and it also supports. And when talking about nerves, it helps keep the functioning of the organs in the lower part of the body healthy, and also those organs support other organs throughout your body, so problems in your lower back can manifest itself into many different things. So something that a lot of people aren't aware of when they come to see me is they'll complain about a foot pain or a knee pain. And while there could be local injury to those areas, that's very often the case. The root cause is in the lower back. If you study dermatomes, you'll realize that there's a pretty strong correlation and relationship between nerve dermatomes and Chinese medicine meridians and channels. I mean, there are places where the two different medicines in science come across and cross-correlate, and those are helpful for a practitioner to use dermatome charts to assess what part of the back is having problems. So this is something that I do, and it's very helpful. So when a patient comes in, it's 3 minutes on this stream. So when a patient comes in, I will realize if there's a pain in the back of their leg. That's often what they call the bladder channel, or the urinary bladder channel in Chinese medicine. But it's also, there's an association to the upper sacrum or the lower lumbar of pain going down the back of your leg. If it's more the outside of your leg, it's a little bit higher in the spinal area, maybe a L5. Or if it's in the front, you're moving across your knee, maybe it's L4, or on the inside of your leg, maybe it's L3. And then there's not always a nice clean relationship, but it's a very strong general indication, because in the lumbar you could have misalignments in the lumbar, the bone structure, and those can have certainly the strongest effect at that point where the nerve root comes out of the spine, but that misalignment can also affect adjacent nerve roots through swelling or misalignment, muscle tightness. So, acupuncture can help definitely address the muscle tightness to some degree. The Tui Na or Chinese massage can help massage bone structure in relation to the muscles and restore some alignment. And so we're coming up on 5 minutes on this, and I know I've covered a lot of information. I hope some of it is of interest to you, but I'll leave you with a last tidbit, and that is, and I was just thinking about it a moment ago, because I'm really doing these videos on the fly. Now, I don't do a whole lot of preparation. I think about my experiences and what I know, and I just want to share that with you. But the one thing I wanted to talk about in terms of, oh yeah, so my philosophy and probably many philosophies of the acupuncturists and Chinese medicine doctors. When I see somebody come in, it's very easy to observe a lot of the misalignments in somebody's spine or bone structure. And so my general philosophy is it's not my intention to bring your spine back into a perfect alignment. Now, first of all, that alignment could have been as a result of an injury a long time ago. It could be genetic. It could be that your spine has been like that for many years, in other words. And so all the surrounding structures have conformed to that. And that's just life, you know. If you're out of alignment, and you're out of alignment for a long time, your body's going to adjust to that. And if you have any problems associated with that, sometimes those problems will be relieved with a very minor change or decrease in swelling in that area. So it would behoove as an acupuncturist, if you're an acupuncturist and you're listening to me talk about how to bring stuff back into alignment, you know, if you're not seeing a chiropractor, then don't try to bring, it shouldn't be your goal to bring everything back into alignment. The goal should be just to relieve pain and to relieve the suffering that the patient is going through, but the objective shouldn't necessarily bring everything back into alignment. So any type of what you might consider a radical change can bring about other problems. You know, like I said, the body has become accustomed to that, what you perceive as a misalignment. Don't go trying to straighten everything out, especially, and even if that's the objective, you don't want to do it you need to do it gradually, because radical changes can bring about some radical problems. So this is Challen. Hope you got some value from this. And I will speak more about the lower back pain and working with the lower back in future videos. So I hope you got some value from this. And bringing acupuncture mainstream one talk at a time. And I'll see you on the next video. Bye.